Have you ever wondered about the ethics behind mandatory vaccinations? In the face of a global pandemic like COVID-19, this question becomes crucial. Today, we explore whether mandatory vaccination is necessary or if a payment system for vaccination is a better approach. The urgency of vaccination arises from a grave public health threat. COVID-19 has claimed millions of lives and continues to inflict economic and social damage worldwide. Hence, if a vaccine is deemed safe and effective, we must consider the necessity of mandatory vaccination. For mandatory vaccination to be justified, 4 key conditions should be met. First, there must be a clear and grave threat to public health. Second, the vaccine needs to be proven safe and effective. Third, the benefits of mandatory vaccination should outweigh alternative options. Lastly, any coercion involved must be proportionate. Current statistics reveal the alarming death toll from COVID-19. With over 1 million lives lost globally, we must acknowledge the severity of the situation. This backdrop raises the ethical question: should we impose mandatory vaccinations? Safety is a critical concern. Historically, no vaccine has been developed for coronaviruses. Thus, while there are strong testing protocols in place, risks remain. Balancing the urgency for vaccination against the need for utmost safety will be a real challenge. Another option is incentivizing vaccinations instead of mandating them. If society cannot rely solely on individuals' altruism, could incentivization work better? Offering compensation for taking on vaccination risks might be persuasive, especially among populations at lower risk. Mandatory policies have been implemented successfully in various countries. For instance, Australia's "No Jab, No Pay" initiative withholds child benefits from unvaccinated children. However, such coercive measures can raise ethical concerns about personal freedoms and autonomy. Coercion should always be the last resort. If voluntary options exist, they should be prioritized. Instead of relying solely on mandatory measures, a payment model offers several advantages. It respects individual choice while still achieving public health goals. This model can take different forms. Cash payments can motivate people to get vaccinated, while benefits in kind may eliminate the perception that vaccination is unsafe. An enticing way of showing appreciation could even involve incentivizing those who vaccinate to donate their payment back to health services, combining altruism with individual benefit. Moreover, non-cash benefits, like increased freedoms for vaccinated individuals, can incentivize vaccination while maintaining public trust. This creates an environment that values choice and participation over coercion. In conclusion, vaccination against COVID-19 raises complex ethical questions. Both mandatory vaccination and payment for vaccination have their merits. However, precise policies will depend on safety, effectiveness, societal preferences, and the evolving nature of the pandemic. If you're interested in supporting vaccination efforts, whether through advocacy or volunteer work, consider sharing this video. Engage with your community about the importance of vaccination and help dispel misconceptions. Together, we can navigate this public health challenge effectively.
Thanks for watching Zenvix. Subscribe for smarter health and science.